Neuropathy can sometimes be hard to understand, and millions of people suffer with this debilitating condition. That's why we have Dr. Joshua Logan from True North Health Clinic here to talk about diagnosing neuropathy.
Yes.
Good morning.
Good morning.
Always good to see you on a Thursday.
Yes, always. It's always a good morning to start here.
All right, so can you tell us about the tests that
Yeah.
True North Neuropathy performs to kind of determine the diagnosis?
Yeah, absolutely. So neuropathy can come in a lot of different shapes and sizes. So for many people, it's numbness, burning, tingling sensations that they have in their hands, but also in their feet. And so we need to get to the root cause of what's actually causing it. So we have multiple different tests that we use in our practice to where we can actually see to the exact percentage of what nerves are damaged.
Ooh, wow.
And so with people dealing with balance issues, it's a certain nerve that's damaged. With people dealing with cold sensations, hot sensations, burning sensations, those are all different nerves. And so we do different tests to determine which nerves are actually being damaged, so we know how we actually need to go about helping it. But then we also do different tests to see, is this a blood flow and circulation issue? Because the blood flow is what heals the nerves, it gives the nerves food. So if there's no blood flow, the nerves starve and they break down as well. But then we also potentially might even need to do x-rays as well, because many people with neuropathy in their feet, it's all coming from the lower back potentially. If those nerves are compressed, because those are the nerves that send signals to the feet.
Yeah.
And so if there's misinformation there, their brain's not going to sense it properly.
So we're talking testing and
Yes.
x-rays. It kind of all sounds like an examination.
Yeah, a full detailed examination to make sure that we actually can feel confident that this is a case that we can help with. Because so many people, they go to their primary care doctors or their neurologists and they stick them with needles, send signals, then he says, hey, you have neuropathy, you don't have neuropathy, here's a medication. And so we actually want to get to the root cause to where we're not going down the path of more pills, more medications, and potentially surgeries or amputations.
It's like those Band-Aids on a broken bone.
Exactly.
Doesn't always work. Okay, so once you've done the examination, it's come the diagnosis, you have neuropathy. Talk to me about the treatment plan.
Yeah, so it's not a cookie cutter treatment plan for every single person. We need to know what each person needs. And so we have very specific processes to help people heal. And the majority of it can actually be done at home, which is wonderful.
Yes.
Which allows people to get results much faster versus them having to come into our clinic multiple times a day potentially. But it allows people to actually get the healing that they need from the comfort of their home when they're traveling. We've had people go over to Italy on cruises and they're still able to get relief and get actually recovery because of the treatments that we have.
But that's nice too, and the fact that you're able to teach them so that it's like one of those, what is it, if you teach a man to fish, he feeds himself for life.
Exactly, and that's the whole goal, is like, I do not want people to be reliant on medications or reliant even on procedures or processes as well too. Like, we want people to know, hey, this is something you could do that's going to help you for the rest of your life. And that way they can get their life back into the things they love again.
But it's nice that True North is able to give people that option, but also like there is more than just having to suffer or having to mask with pills. You guys do it all.
Exactly, and that's our focus, is like our whole purpose is getting people to live their fullest potential. And we know when pain gets in the way, it is debilitating, it's not fun. And especially with summer and all that coming in the near future and getting outside, we want people to be able to do that comfortably and confidently as well.
All right, Doc, you still doing that $49 special?
We are actually, and so the $49 special includes that full consultation, the full examination that I actually just talked about as well as that second visit where we can sit down, go through all of our findings. If this is a case that we can help with, we'll go through really all of our recommendations. And if it's something that we can help with, we'll be able to get started right away. And typically our patients are seeing relief within the first couple weeks, and that way we can actually get people's lives back, which is exactly why we're here. And
it's something that has a personal thing for you.
Yeah, I mean, my mom dealt with it and my grandpa, and so it was very personal. And also my mother, or my father-in-law, my wife's dad, has also dealt with it too. And so we've been actually able to help really my whole family experience true health naturally without having to go down the path of medications as well too. And so it's been a huge honor to take care of my family, but now we're able to take care of our community using some of the same systems to allow people to actually get true relief, whether that's from diabetes, chemotherapy, Agent Orange exposure, botched surgeries. We've been able to help so many individuals get their life back because of neuropathy.
And you guys are taking clients right now?
We are. Our team's ready. Give us a call. I think our number's on the screen there, and our team will be able to get you scheduled and get you into our office as soon as possible, to where we can sit down and truly see, can we help, and what the best route of recovery is as well.
Well, Doc, thank you so much for being here. As
Yes.
always, it's a pleasure.
Thank you so much for having me.
All right, guys, you got to snag that $49 deal. It is only for the first 25 callers, so make sure you call up that number that you saw on your screen. We want you guys to get situated. We don't want you to live in pain.
Exactly.
That's not what True North is all about. That's not what we're all about. That's why we're bringing you True North Health Center. Make sure you call that number on your screen for that special $49 offer. We'd also like to say a special thank you to True North Health Center for bringing us this segment. Thank you so much, Doc.
Thank you.